The Healing Smiles Project is an initiative of Hope Foundation in collaboration with SG Mobile Healthcare, and the project is aimed at getting healthcare delivered to hard-to-reach areas. And this time, the bus made a stop at Dupari, a community in the Wa East District in the Upper West region. Upon arrival at the community, the team made courtesy calls on the leaders of the community per the custom, and they were briefed on the agenda, which was a health screening and a donation of clothing to the people of the community. After the courtesy calls were made, the health screening, and also gave them advice on how they could improve upon their health with regards to their diet, daily exercises, and some of the things they needed to stop doing in order to improve upon their health. 250 people partook in the health screening, ranging from 60 years to 6 months. Some of the diseases which they were tested and diagnosed for were malaria, HIV/AIDS, hepatitis, among others. One of the problems that were prone in the community were body pains and pains of the joints due to their farming activities. One of the special cases that the medical team came across was that of a man with a special hernia condition, and also an old lady that had her leg infected due to an injury she sustained at her farm as a result of an accident. Her leg got pierced by a thorn. She, however, didn't seek adequate medical attention and left the injury untreated for about 2 weeks, and this resulted in the leg swelling severely and also the sore getting infected. We feared that if not for the timely intervention of the medical team, the infection could have poisoned her whole body. But due to the timely intervention of the medical team, the old lady was attended to and given the right medications to salvage the situation. Sicknesses diagnosed and given the adequate treatment, but they were also shared clothing by Hope Foundation. At the end of the day, they were indeed smiling, and these were healing smiles because they had their sicknesses attended to and they had clothes that they were very happy with. On our visit, one story that caught our attention was that of Mba Awesu, the blind man that is able to sense where he's going with his feet. We realized this when he had a session with the medical team. After he was being attended to, he got up and all on his own he started walking home. This prompted the attention of the team, and we had an interview with him to know how come this is possible and how he's able to find his way all by himself without the direction of anyone or even using a walking stick. Let's listen to the story of Mba Awesu.
Okay, Assalamu alaikum, Jama. But yeah, the Banyi Hope Foundation. What know why I have screening me. Chatting the Bora Carane Yala Biala. Don't want to turn yanka. It would change the Jabatiri, so Walatona. The one character appear he be a lanya. Walanta imam man tonto chile. Atro banje jacha baton yara.
This waiting comes with trials and challenges. Nothing in life.
And around in the 1960s when he was in Form 1. But according to him, after he got blind, he was at home for some time. And when he started working out, when he accepted the fact that he was blind, according to him, God has this kind of inspiration he's given him that he's able to use his feet to know where he's going. And this is Dupare, a village in the Wa East District, where he resides. And according to him, he knows every part of the village. And when he's walking, he needs no one to direct him. And according to him, he's even saying that if you are a visitor here, he can direct you to where you want to go. And we just asked him, whose house is this? And he replied that this is Mba Iliasu's house. So we want to illustrate for you to see. He's going home, and we are going to follow him to his house without anyone directing him. And Allah always says in the Holy Quran that which of the favors of Allah would you deny? And Allah subhanahu wa ta'ala also tells us that you can never enumerate his favors on our lives. Even though he has this condition, Allah has a way of still directing him to walk around as if he can see perfectly. This is an amazing miracle, and we want to illustrate for you to see how he would go home.
Waiting comes with trials and challenges. Nothing in life is free. I wish that somehow you tell me out aloud that on that day I'll be okay. But we'll never know, 'cause that's not the way it works. Help me find my way. My Lord, show me right from.
As you've seen it for yourself, our father was able to walk his way to his house. He was able to open his door all on his own. And he says that he's able to sense that with his feet. Allahu Akbar, Allahu Akbar, Allahu Akbar. Allah tells us in the Holy Quran that وَإِن تَعُودُوا مِن نِعْمَةِ اللَّهِ لَا تُحْصُوهَا. You can never enumerate the favors of Allah subhanahu wa ta'ala on our lives. Our father has again said that he has memorized 64 chapters of the Holy Quran. Allahu Akbar. And it is not just now. He says that when he goes to war, or when he's even in a car, he knows that they've gotten to this town, and he can feel with his feet that this is where I'm going. And when he gets to a gutter, he can feel with the feet that I'm supposed to jump over something, or this is this person's house. So if he's going to war and the car gets to war, he knows that I'm in war, feeling it with his feet. This is an amazing story, and it is an outreach program Hope Foundation has embarked on. Our father has already been diagnosed of all the diseases he has, and he has been given the medications, and he's now back home. We are just here to do a health screening for the people of Dupari in the Wa East district, and we covered this amazing story for you to know that definitely disability is never inability. And our father has 2 wives, and he's living happily with his family here in Dupari. Thank you very much. And this is Hope Foundation, and we are covering the story of our father Mba Awesu, who can see perfectly, not with his eyes, but with his feet. Allahu Akbar. Thank you. We've heard it all from our father. He's saying that the main problem they face is that the distance from here to town, the access to good healthcare facility is a bit far away. And even when someone is sick, the person is weak. If you are not strong enough to even board the car, and you don't have the finances to pay and get to the capital, that is why, so that you can get medications, it's very, very difficult. I think we saw one of those cases where a lady had a sore that was very serious, but she was just sitting down with it because she couldn't afford, or she didn't have the strength to board a car and go to the regional hospital for treatment. So I think that they will need a CHIPS compound. They need a health facility in a community like this so that they can have immediate access to healthcare. We've heard it from our mother. What she's just saying basically is that the women of Dupari are facing serious challenges with regard to healthcare delivery. The nearest hospital that they have is at Bulinge, which is a town or a village close by, and they need to walk quite a distance before they can get there. And according to her, if they are facing any health challenges, what they do is that they go to a drugstore and they just prescribe any drug for them. And sometimes they come and take these drugs and the situation becomes worse. So she is soliciting or pleading with those that can help. They need at least a CHIPS compound in their community, and they need exercises like this. This is an outreach program by the Hope Caravan of Hope Foundation, and we are collaborating with SG Mobile Healthcare, and we are having this health screening and some donation of clothes to help the people of Dupari. So if you are a philanthropist, government agencies and all, we are appealing to you that These people need health facility dearly, such that they can attend to emergency health needs. With this screening, we've met a lot of instances that if we didn't come, we fear for the worst. So we are appealing to everyone that we are trying our best as an organization, as Hope Foundation, to spread healthcare as much as possible by collaborating with the right agencies. But we are also soliciting to everyone that can help and come to the aid of our mothers as well. They're also saying that they need some skills, such as tie and dye making, soap making, so that they can at least rebrand the businesses that they do to earn enough to take care of their children. So,
I'm waiting for some